A study in the New England Journal of Medicine found that 73% of adults between 57 and 85 consider physical intimacy important to their quality of life. But 43% of women and 31% of men over 65 report a significant decline in desire. Nobody talks about it, not the person experiencing it, not their partner, not their doctor. The silence creates distance, the distance creates loneliness, and the loneliness becomes a health risk all on its own. Declining desire after decades of marriage is common, but common does not mean permanent, and it almost never means what you think it means about your relationship. I'm Dr. Rosalind Keller, 36 years in family medicine. I don't sell supplements. I don't run a clinic anymore. I'm here because someone should tell you what your doctor doesn't have time to. You are lying in bed next to the person you have loved for 40 years. The television is off. The house is quiet. You are both awake. You both know the space between you used to be smaller. There was a time when closeness happened naturally, when desire was not something you had to think about. Now it feels like a foreign language you both used to speak fluently. Neither of you knows who stopped first. Neither of you knows how to bring it up. So you say goodnight. You turn off the lamp, and the conversation that could change everything goes unspoken for another night. I spent 36 years listening to couples describe this exact silence. The myth I need to correct is that low desire in a long-term relationship means the love is gone. That is not what the research shows. Desire is not the same as love. Desire is a biological, hormonal, and neurological response that changes with age, medication, health status, and emotional state. Love is a choice, a commitment, a presence. Most couples who experience declining intimacy still love each other deeply. They just cannot find the bridge between love and physical closeness anymore. And that bridge has concrete, identifiable obstacles that can be addressed. Here is what changes biologically. In women after menopause, estrogen and testosterone both decline. Estrogen affects tissue comfort in intimate areas. Testosterone, which women also produce in smaller amounts, directly influences desire. When both drop, the biological drive for physical closeness diminishes. It is not psychological failure, it is hormonal reality. In men after 65, testosterone declines gradually, about 1 to 2% per year after 40. By 70, many men have testosterone levels 30 to 40% lower than they had at 30. Low testosterone reduces desire, energy, and mood. On top of hormones, medications play a major role. SSRIs reduce desire in up to 70% of users. Beta blockers reduce physical arousal response. Antihistamines dry out mucous membranes. Statins have been associated with reduced desire in some studies. The average senior takes 5 medications. At least one of them is likely affecting their intimate life. Before we go further, I need you to hear this. If you have any of the following, stop and call your doctor before changing anything I described today. Kidney disease of any stage, liver disease or cirrhosis, diabetes treated with insulin. You take blood thinners like Eliquis or warfarin. You take a diuretic. You take a proton pump inhibitor like omeprazole. You have uncontrolled high blood pressure. This video is education. It is not personal medical advice. Nothing replaces a doctor who knows your chart. Now, with that said, here is what the research shows. Let me tell you about Grace and William. Grace was 69. William was 72, married for 44 years, retired school teachers from Kansas City, Missouri. They loved each other. They held hands at the grocery store. They ate dinner together every night, but physical intimacy had stopped 3 years ago. Grace assumed William was no longer interested. William assumed Grace was no longer interested. Neither said a word. The silence became a wall. Grace told me in a private visit that she felt invisible. William told his doctor at a separate visit that he felt like a failure. When I sat with Grace, I asked about her medications. She was on sertraline for mild anxiety, which she started 3 years ago. The same time intimacy stopped. I asked about William's medications. He was on metoprolol and finasteride. Both reduce physical response and desire. The timeline matched perfectly. The desire did not vanish because of the marriage. It vanished because of the medications. Nobody connected the dots because nobody asked the question. Here is your first self-assessment. Answer these questions privately. Has your desire declined gradually over years, or did it drop noticeably within a few months? If gradual hormonal decline and aging are likely contributors. If sudden, a medication change is the most likely cause. Review any medications you started or had dose adjusted in the months before the change. SSRIs, beta blockers, finasteride, antihistamines, and anti-anxiety medications are the most common desire suppressors. Here is your second assessment. Think about your relationship separately from the physical component. Do you still feel emotionally close to your partner? Do you still want their company? Do you miss the intimacy, even if you do not feel the urge? If the emotional connection is intact, but the physical desire is absent, the cause is almost certainly biological or pharmacological, not relational. If the emotional connection has also deteriorated, the desire issue may be secondary to unresolved relationship stress, grief, or unspoken resentment. Both situations are addressable, but they require different approaches. Things that suppress desire after 65 beyond medications. First, chronic fatigue. If you are exhausted, desire is the first thing your body sacrifices. Fatigue from sleep apnea, hypothyroidism, or anemia must be ruled out. Second, body image changes. Many seniors feel less comfortable in their bodies after weight gain, surgery scars, or physical changes. Discomfort with your own body makes vulnerability with a partner feel impossible. Third, pain during intimacy. For women, tissue thinning and dryness cause discomfort that turns physical closeness into something to avoid rather than enjoy. For men, performance concerns create anxiety that suppresses desire preemptively. Fourth, grief and depression. Loss of friends, siblings, or health can create an emotional weight that makes desire feel inappropriate or impossible. Here is what helps. First, the medication conversation. Bring your partner and your medication list to your doctor. Ask specifically, could any of these medications be affecting our intimate life? There are almost always alternatives. Sertraline can often be switched to bupropion, which has far lower rates of desire suppression. Metoprolol can be switched to a different blood pressure drug class. These conversations happen every day in medicine. Your doctor has heard it before. Second, topical estrogen for women. Low-dose topical estrogen cream restores comfort and can reignite desire indirectly by removing the pain barrier. Third, exercise together. Couples who exercise together report higher desire and relationship satisfaction. Walking together for 30 minutes raises endorphins and creates shared positive experience. Fourth, non-demand physical touch, holding hands, back rubs, sitting close on the couch. Rebuilding physical closeness without the pressure of performance reignites comfort with touch, which is the foundation desire needs. This is the Keller Intimacy Reconnection Protocol. Step 1. Have the medication review conversation with your doctor within 30 days. Bring the timeline. When did desire change, and what medication started around that time? Step 2. Start non-demand physical touch daily. Hold hands. Embrace for 20 seconds. Touch without agenda. Rebuild the comfort with closeness before expecting desire to return. Step 3. Have the honest conversation with your partner. Not about performance, about feelings. Say, "I miss being close to you. I think something is getting in the way. I want to figure it out together." Those 3 sentences can break a silence that has lasted years. Grace's doctor switched her sertraline to bupropion. Within 6 weeks, Grace noticed her desire returning, not dramatically, but noticeably. William's doctor reduced his metoprolol and switched his finasteride to a different medication. William noticed improvement over 2 months, but what changed their relationship was the conversation. Grace told William she thought he had stopped wanting her. William said the same thing back. They laughed through tears. They started holding hands in bed again before anything else changed. Grace told me the holding hands was the beginning of everything. Write your age below. And tell me, how many years has this silence been going on in your home? You do not have to share details, just the number. I read every comment. Here are your 5 takeaways. 1. Low desire after 65 is usually biological or pharmaceutical, not a sign the love is gone. 2. SSRIs, beta blockers, and finasteride are the most common medication culprits. 3. Ask your doctor about alternative medications with lower intimacy side effects. 4. Rebuild physical closeness through non-demand touch before expecting desire to return. 5. Have the honest conversation with your partner. The silence is more damaging than the topic. This is the conversation your appointment never had time for. The question you wrote down and then crossed out in the waiting room. I don't sell anything. I don't have a practice. I profit from you not needing me. You deserve answers without embarrassment. I'll see you in the next one.